Gene therapy. Gene therapy uses genes to treat or prevent disease by inserting or altering and removing a gene. So, in gene therapy means it's a medical technique for correcting defective gene that are responsible for disease development. So, in this medical technique, we are correcting the defective gene by inserting or altering or removing a gene that are responsible for disease development. The main approach that is used in gene therapy is we are inactivating or knocking out of gene, or we are introducing or adding a gene into the host cells or replacing a gene. That is the approach we are usually used in gene therapy. The main indications of gene therapy is gene defect, the single gene defect that cause disease like cystic fibrosis, hemophilia, muscular dystrophy, etc. Then in cancer therapy, gene therapy can be used. Then in genetic therapy also we can do this gene transfer. So there are two types of gene therapy. First one, germ-line gene therapy. Second one, somatic gene therapy. So in germ-line gene therapy, therapeutic genes transferred into germ cells, that is eggs and sperm. It is inheritable and passed on later generation. For safety purpose, we are not using this germline gene transfer. Next one is the somatic cell gene therapy. Here, therapeutic genes transferred into somatic cells. Introduction of gene into the bone marrow, blood cells, skin cells, etc. That is the examples of somatic gene therapy. It will not be inherited for the later generation. It will not be inherited. At present, we are commonly using this somatic cell gene therapy. Next one, vectors in gene therapy. Vectors in gene therapy means to transfer the desired gene into target cell, a carrier is required. Such vehicle of gene delivery are known as vectors. So by using vectors, we are transferring a gene into the host cell. So it can be done by two methods or two classes. First one, viral vectors, and another one is non-viral vectors. Retrovirus gene therapy. In retrovirus gene therapy, here we are using a virus. So the virus genetic material is RNA. So the treated retrovirus will be entered into the host cell, and while after entering into the host cell, by using reverse transcriptase enzyme, this virus changed its genetic material into DNA. So it will start to replicate. So this virus will start to replicate. Along with that, these genes also will be replicate. That's why the genetic material will be entered into the host cell. It is this type of retroviral gene therapy mainly used in case of X-linked severe immunodeficiency. And commonly used virus is adenovirus. Non-viral methods that is used in gene transfer. So non-viral method, it's a simple technique and it can be used for large scale production. The physical methods to enhance this gene transfer, the first one is electroporation. Electroporation is we are using short pulse or high voltage to carry DNA. So here what we are doing is we are using high field strength of electrical impulses to permeabilize the cell membrane for the uptake of DNA. So that is the electroporation method. So here we are using high voltage to carry DNA into the cell. So the main advantage is it's simple and convenient, and the efficiency can be optimized. The main disadvantage is death of cell due to high voltage may occur sometimes. Another method is using a gene gun or golden gun biolistics. So gene gun, here we are using gene gun is an instrument used to shoot the DNA on target site. So it's an instrument that is used to shoot the DNA into the target site. Here DNA coated with gold particles which generate force to achieve penetration into the cell. So it is discovered by John C. Sanford, also known as golden gun. So gene gun, here we are using a DNA coated gold particles that will generate a force to achieve the penetration into the cell. Next one, sonoporation. So sonoporation means making a pore by using a ultrasound. Okay, so here ultrasound waves that produce small pores in cells. Okay, that will leads to diffusion of gene into the cell. So firstly what we are doing is we are placing the gene in front of the cells and we are making a ultrasound waves, and due to this ultrasound waves there will be a small production of a small opening of cells will be there. By this pores the DNA will be enter into the cell. So that is known as sonoporation. Next one, magnetofection. Magnetofection is a simple and highly efficient transfection method that uses magnetic field to concentrate particles containing nucleic acid into the target cells. So in magnetofection we are used magnet under the tissue and it is attracted the genes. Okay, so that is the magnetofection. And another method is hybrid method. So in hybrid method we are combining two or more methods together. So that is known as the hybrid method. The main responsibility during this gene therapy is patient education, family education, counseling, counseling services, then health education to be done, then the informed consent should be taken, the methods of gene therapy should be explained, the complications or side effects that can be occur during this gene therapy also informed. So then legal documents, legal and ethical consideration to be done.